All right, boys and girls, how you doing? RussellTrueResults303.com. Check out the website. Check the description box below for the link to that website and links to my social media sites where you can contact me as well. Coming at you today with another video on low back pain and how to hopefully prevent or at least relieve low back pain. So I've done a video on releasing the hips. Now there are also those were on the back of the hips, the smaller muscles of the back of the hip. Now we've got some muscles that connect at the front of the hip and then they go up and connect to the low spine. So once again, right here, book's coming out so you can see. You can see right here, it's going to be a majority of these psoas muscles and the iliacus. I can't see because I can't see it. But so we can see right here, all these little muscles are going to connect right here at the front of the femur, the thigh, and they come up and they connect right into the spine, into the low back. So what you have to see is if this muscle starts to tighten up and cinch down, what's it doing? It's pulling your low back into flexion. So, like I said, if we're here, it's going to originate right here in the groinish area, and that muscle comes up and connects to the back right here. So this is kind of how the muscle works, here through into here. So if this muscle is coming closer together, which would be this way, if it's coming closer together, what's it doing? Like that. You can see that distance change. From here to here, that distance gets closer when that butt pushes out. Now this distance is smaller. All that tension is on the low back. Of course, that's an exaggeration. That's called lower cross syndrome. I'll try and make a video on it, but now we just need to figure out how to release that muscle, because like we said, we're here. They're connecting to the spine itself from the front of the leg. They contract. Next thing, the pelvis is tilting forward, and we're creating pain in the low back. So what can we do to release these muscles? Of course, there are some stretches that we can do, but of course, we always want to do some deep tissue work on these muscles first, because you can't stretch something that's in a state of contraction. It's going to fight against you. So we need to release these muscles and loosen them up, and then we can go into the stretch. All right, so this is going to, like I said, we can see it starts in the front of the hip, and then it goes into the low back. So we're coming to the ground. See if I can get my camera right. I don't think it's going to work. Camera's all messed up. There we go. All right, so once again, we can always start with a foam roller, but you know where it's going. We're going to end with the softball or the lacrosse ball, so it would be the same thing. We're on our stomach, and we're just really trying to roll out the stomach area. But once again, the thing we've got to remember is those are deep tissue muscles. Those are behind, the six-pack. Those are behind the, all these superficial muscles, the obliques, the transverse abdominis, the rectus abdominis, I think it's called. I can't remember off the top of my head. I got too much going on. But that's deep down inside, underneath all those tissues. So this is where we need to bring the softball or the lacrosse ball in. So same thing. We're going to take it. You're just going to select a side. You can see where I'm putting it right here. We're going to come down on it, and then we're just going to roll around until we find those tender spots. Right there is a tender spot for me. And just sit on it and relax. That is a tender spot. The softball is usually going to be your best bet. This one I think is a little too small, where there's not enough distance between you and the ground, especially once the ball starts to sink in to the abdominal area. So once again, we're getting down in there deep, just rotating back and forth. Then of course we always want to do both sides. So same thing, we're here, find that area, you can see it's going to be right there. And then we're rolling in on it, stretching it out. All right, so there we go. That's what we're going to do there. Deep tissue, we're working all the front of this hip. We can attack the back if we would like. Same thing, we're going to be here. We're going to find right next to the spine. We're not going to be on the spine, but it's the same thing. Now we're here, and we're just rotating in that area, trying to find a tender spot. I like to move my legs. For some, that might be dangerous, so just don't worry about it. But I like to move my legs back and forth, really focus on digging in close to the spine. We are not on the spine. We're next to the spine. Focus on those muscles. Once again, you can try the smaller ball, the baseball, for me, it's a hockey ball, a lacrosse ball, something like that, to focus on those issues. Now that we've kind of loosened up these areas, we need to stretch them. Because as we know, like we talked about before, it pushes the butt back and it shortens the area here. So now we need to stretch that area. So what we can do is we come to a knee just like this, and then we're focusing on just pushing the hips forward. You can see that little movement. We're not coming in like this. This isn't getting as deep of a stretch. So we're here just pushing the hips forward only. Really focusing here. On this leg, now we can put that arm directly up in the air. See if I can get my head in. It's not going to happen, but we're here. Arms straight up in the air, really stretching out this area. Same thing, we can rotate sides. We're here. Up, just pushing the hips forward. We're not leaning into it like that. We're here, hip push forward, arm up and extend. Next, what I like to do, which you can do as well, is I like to come in here and I'll reach back and just grab my leg. This, you have to get a little balance into it, but I'll come like this and focus on that stretch as well. Same thing here, up, focusing on that nice big stretch. Other places we'll call it like the couch stretch. So here's my couch. You can see we're just going to prop that leg up, bring the knee in close, and then we're here. That'd be the equivalent of me holding it. Just now you don't have to worry as much about the balance. We're here, arms straight up in the air, really stretching the front of the thigh, the hip flexors, that abdominal area. Do the same with the other side. We're here. Nice big stretch. Same thing, foot's up on the couch. I like to add rotation if I'm near a wall. Or if you're on the couch, you can rotate, arm up, stretching. Same thing. All right, so there you go, folks. This is going to be deep tissue release and stretch for the hip flexors, the psoas muscles, all those deep muscles that can cause the low back pain when they become overactive and too tight. This is what we need to do. Once again, if it's a chronic area, it's something that you're going to have to perform consistently. And then once we've resolved the issue, this is something that we can kind of taper back, and maybe you're only performing on Wednesdays and Sundays, just Saturday. But we need to make sure that we are taking care of our bodies in this way, because if we are consistently working out and putting the body to the test, these issues are going to come up, and these are good prevention techniques and prevention exercises that we can perform to ensure that we stay in the gym and stay healthy. So once again, thank you for watching the videos. Connect with me through the description box with the links. Share this video, like these videos, and we'll be coming at you with another one soon.